We're quite a large practice in Lambeth. We've got just under 16,000 patients. So we have 5 partners, 7 salaried GPs. We have a nurse practitioner, a prescribing pharmacist, assistant practitioner, and 2 nurses. We have patients that come from a poorer background, but we've also got very wealthy patients as well.
Our practice has been very affected from the beginning. Lots of our staff members all of a sudden went off sick or were isolating because of one of the household members had symptoms. So all of a sudden we were left with very skeleton staff, and we have to think very quickly how we would enable to get people who can work from home actually do it. When I was sent the details of the new telephony app that it was provided to us, it was so much more straightforward. Everything was organized. There was no issues whatsoever in terms of setting people up. It was really easy things to do. And I've attended the webinar to actually see how it works in practice. And after the webinar, the next day, we switched everything on and it was working ever since. So it was a real lifesaver that enabled actually our reception staff mostly to work from home.
It's worked very well for the GPs actually, because when they were using their own mobiles, their own minutes, they were calling from a withheld number. And our patients are obviously used to seeing the practice telephone number. So they weren't picking up the withheld numbers, so that was causing quite a lot of stress for the doctors because they'd have to try 2 or 3 times and then, to eventually get through. So now that the call shows up as a practice number, it's actually made their job a lot more easy in actually contacting the patient. So I think that's been very helpful. It also allows us to transfer calls between one another, so that's really helpful too. So, if a patient's missed a call, they call the practice, and then if we can see that the doctor is free, we can put that call straight through to the doctor. So that's really helped us as well.
For now, in terms of staff working from home, it's excellent tool for us to see what they are doing from home, what's their working pattern at, and in terms of me sharing the workload, I can see who's actually busy, who's not, because of the amount of calls that is coming in. Because now that things are actually slowing down a bit, I can schedule reception staff work accordingly because we are not getting hundreds and hundreds of calls every single day. And I have got a couple of receptionists working, so I can plan for the day and give particular members of staff different bits of work. So that's really helpful.
Yeah, we're watching how many calls come into the practice, how many are missed, how many are picked up, how long
it takes to get through, which is a big thing for us.
Yeah, no, that was huge for us.
And I think our patients have particularly made the use of online access, so they are booking the telephone triage appointments online as well, so they don't have to ring the practice. They are really on the ball with doing all of that online, so it's good.
I think the difference with the amount of traffic that's going through online is that because it's telephone triage appointments, there are far more appointments available online, so patients just go directly online to book. I think that's moved quite a lot of the traffic off the phones. I suppose to me the biggest benefit is actually if we had to close the practice, if we had to close our doors, we could still manage our service. Probably the initial setup. I mean, luckily Angelica's very IT savvy and just sat down quietly. I mean, it probably took you, how long did it take?
Few hours, I would say.
Yeah, it was an afternoon.
We have quite a lot of users. We've got, I think, 30 plus users. So
yeah. So it was just taking that time to work through the instructions.
I think for the reception staff, because that is something completely new for them. Obviously, some of them are not very IT savvy, so they needed initial help, how to actually get everything working on the laptop. So I've spent quite a lot of time, and Michelle and one of the senior receptionists to try to explain to them how to log in, etc. So For them, it was just getting their head around how to access that, how to make sure everything is working. In order to download the software, you have to have the newest operating system, and for a lot of staff members, it's a barrier because they wouldn't have that on their personal laptop that we try not to use anyway. But the equipment needs to be up to scratch actually in order for it to work. So that was a bit of a challenge actually. And even in the practice, we had to change everything in terms of how many people we have working in the reception at one point, trying to spread out all over the practice as much as we can, have the minimum possible staff coming in anyway, doing the rota for that and plan who can work from home, who cannot work from home, who's going to have a laptop on a particular day, how are we going to get those laptops swapped over for another member of staff. So there's a lot of planning that's gone into it actually in order for us to carry on as a practice and to care for our patients.
They probably haven't noticed because it's been a seamless changeover, so they wouldn't see anything different. I think the feedback that they've had is that they're happy that we're answering the calls and that we're at the end of the telephone to help when they need. But I think from their perspective, it just hasn't changed at all, so they wouldn't have noticed anything.
The webinar was really helpful because reading dry text of the manual is not the same as actually someone showing you how to use it. And also because I've looked at it before the webinar, I could then ask relevant questions, things I wasn't really sure about because maybe they've been missed out of the manual or I wasn't exactly sure how it would work in reality. So I could actually use the webinar and last bit of Q&A session to actually get my questions answered properly. This is why I was so confident to switch it on, go live very next day after the webinar. So that was very useful. I guess my only tip would be make sure you test it before you go live. Make sure your staff is comfortable using it, which I'm sure they will be. But before I went live, I just made sure that my reception staff downloaded it. It's all up and running. They are comfortable using it. This testing feature is really good because it made me really comfortable going live afterwards once I knew everyone was set up and comfortable.
So much can be dealt with over the telephone and video call. I mean, if you'd have told me that all of my GPs or all my clinicians would be video calling 6 weeks ago, I would have laughed. That just would have not. Just wouldn't have been, just wouldn't have happened. So it's really forced us into sort of making those leaps and steps, which is great actually, because it's shown us all that we can do it and how useful video call is. And we don't need to have people taking time off of work to come into the practice because we can do so much over the phone and through video call, etc. So I think that will definitely change how we manage our caseloads going forward, most definitely.